Hi, my name is Nick Scheren. I'm a type 1 diabetic. I was diagnosed when I was about 12 years old. So type 1 diabetes is thought to develop because of an autoimmune disease in the system. No one is exactly sure of how it happens or why people get diagnosed with it, but some thoughts are that it is a abundance of starch in the system. One of the main reasons people do develop type 1 diabetes and type 2 diabetes is obesity, which also is a fact of eating unhealthy. When I was younger, I ate extremely unhealthy. I was chicken fingers and french fries every day. So that is why we think that I developed it, because of my unhealthy eating habits, too much starch, and just some kind of flu or some kind of autoimmune disease triggered some cell in my body, and I have it. So when I was diagnosed at 12, I was extremely skinny. I lost so much weight. I was drinking constantly. My body felt so dry. I was obsessed with water. I had blurry vision, headaches all the time. And then one night, I just could not stop going to the bathroom. I was urinating every half hour. Next morning, I passed out, went unconscious, went to the hospital, woke up in the intensive care unit, and the nurse came up to me and said I had diabetes. No idea what it was. I thought I can get rid of it, but it's something I'm going to have to live with the rest of my life since there's no cure for it. I have to go to the doctors every 3 months to make sure my prescriptions get renewed. The insulin I take, I get a 3-month supply. Normally without insurance, it's about $1,000. With insurance, it's $100. The test strips for a 3-month supply cost $35. The Lancets cost about $20. And to start off the insulin pump, without insurance, that cost about $5,000 or $6,000. With insurance, it was only about $500. So it's a pretty expensive thing to live with. Insurance always helps. So insulin throughout the rest of my life, something you gotta live with. What type 1 diabetes means is that my pancreas does not produce insulin like a normal pancreas would. So I have to give myself insulin, which is what the pancreas produces, on a daily basis to help maintain my blood sugar. To do this, most type 1 diabetics give themselves insulin shot, which consists of the regular needles and the vial of insulin. What I have is an insulin pump, which is permanently attached to me via a wire, and I have a insertion in my lower back, or you can do it in the abdomen. This gives me insulin every hour to act like a normal pancreas, maintaining the blood sugar of a normal person without diabetes. My daily routine is when I wake up in the morning, I test my blood sugar. Blood sugar in the morning, well, any time of day, should really be between about 80 and 120. Anything below 80 is considered low blood sugar. Some side effects of low blood sugar is sweatiness, extreme hunger, having to drink a lot, the shakes, really weak, fatigue. High blood sugar, usually anything above like 250, 300, you get extremely dry, extremely thirsty, you have to urinate a lot, and eventually if you don't control it, the urination turns into almost water because you have no more vitamins or anything in your body that you're trying to urinate out. For breakfast, I usually have apples, a couple pieces of toast, and a glass of water. Depending on the carbohydrates and my blood sugar at the time, I have to inject or give myself the right amount of insulin to counteract the sugar and the carbohydrates in the apple and the toast or whatever it is I'm eating. For lunch, I usually have maybe a wrap or some kind of sandwich along with some vegetables. Sandwich is pretty much the bread you have to give yourself insulin for because of the carbohydrates. Then for dinner, I usually have a bigger meal of like a steak, a hamburger with some kind of potato. And that, of course, the carbohydrates is the potato. And then throughout the day, I do a little bit of snacking here and there. Pringles, chips, some kind of small fruits, peanuts. Diabetics are mainly supposed to stay away from high sugar products, such as chocolates. Also, you do have to be careful of a lot of vegetables, although it's natural sugar, it is sugar, so it can increase your blood sugar without the proper use of insulin. Good amount of exercise go with any kind of diet, but especially with diabetics, you have to make sure your blood sugar does not go up. It's extremely dangerous when your blood sugar goes out of the 80 to 120 range because you can experience coma. If not treated, you could pass out, and any kind of fatigue, tiredness, extreme hunger isn't good for any person. So proper amount of exercise helps also control the blood sugar. I will have to be on an insulin regimented diet and regimen throughout my entire life. There's no cure for diabetes. The only thing you could possibly do is maybe get a pancreas transplant. So this is going to be a part of my normal routine for the rest of my life. So I test my blood sugar normally between 3 to 5 times a day. You test it before every meal so you know how much insulin to give yourself. And then random times throughout the day if you're feeling like your blood sugar is not where it's supposed to be. And to test your blood sugar, you get one of these test strips. Stick it in the meter. You have a little Lancet device here which pricks your skin to draw out the blood to test the blood sugar. This machine usually only takes about 5 seconds. So once you get number 123, so that's a good blood sugar for diabetic. It's only 3 above where you're supposed to be really, so it's not that much of a concern. You might give yourself a half of a unit of insulin to bring that down. If it's a low blood sugar, which means below 80, what you do is you have about 8 ounces of a juice, orange juice, apple juice, cranberry juice, and that would help bring the insulin back to normal range. If it was higher than 123, if it was 150, 200, 300, 400, you would give yourself the correct amount of insulin to bring that back down to where you want in the normal range, and just rest and relax until that blood sugar does so, because you don't want to exert yourself too much when you have high blood sugar.